Good morning. I'm Amy Towner, CEO of Healthcare Foundation for Ventura County, and I'm here at Ventura County Medical Center at our new North Tower. It's our inpatient acute for West County, Ventura, California, and home to our level 2 trauma and level 3B NICU, and much, much more. We wanted to thank you, the Aramont Foundation and the board of directors, Kathy and Antoinette. It's always a pleasure working with you. You've been a huge, impactful source of funding for us during the most critical time during COVID. We are here now, second phase of COVID with a variant. We're probably going to be instituting the incident command starting tomorrow, once again, every week, because the trend is going back up. So this morning we're going to be meeting some of our doctors inside, and I just wanted to give you a little introduction here and give you a little bird's eye view and say thank you. Thank you for your ongoing support of the unrestricted funds. Those funds for the most critical needs are, at a time like this, the most critical. So thank you very much for all of your support, and we look forward to introducing you to the doctors. Thank you. Okay, so we're inside Ventura County Medical Center, outside of the intensive care unit, and with me is Dr. Thomas Duncan, and he is the medical director of trauma here at Ventura County Medical Center, which is a trauma 2 level trauma center. Dr. Duncan, can you talk about Aramont Foundation and the donation that they gave for the Lucas compression vests and also the CRRT machine? Give them a little highlight on how that's impacted you, your colleagues, and the nurses.
Sure, we really appreciate the efforts and the donation by the Aramont Foundation in terms of helping us out with compressions for Lucas. The Lucas machine works very well in terms of giving compressions when a patient is coding. As such, we do not have to be in proximity to the patient to give the compressions. The fatigue factor is taken out of the equation, and usually the Lucas machine can keep going for as long as you want it to keep going. So it's wonderful to have the machine in place, not only for COVID-19 patients, but also our trauma patients. Our trauma patients sometimes come in and we have to use the Lucas machine in the appropriate setting, and I've seen it work very well. In regards to CRRT, or continuous renal replacement therapy, it is a machine that is used for those that require the dialysis aspect of their health care. In terms of that, we have some of the machines that are utilized, but this is specific for those that will need it in the acute setting. We've had to send patients out to LA on occasion, or even pediatric patients have had to be sent out. And in regards to having this in our system, it is wonderful. It has caused us not to have to send those patients out, and we really and truly appreciate Aramont, and we look forward to working well with you in the future. Thank you.
Thank you, Dr. Duncan, and thank you, Aramont. It is just with great pleasure and pride that we partner with you in this continuous fashion to do so much good for everyone, regardless of their ability to pay, and being able to continue to give our doctors the equipment that they need the most. Thank you so much.
Thank you.